Hi, I'm Mary Lee Potter, the Director of Professional Nursing Practice at Methodist Hospital Metropolitan in downtown San Antonio. Many patients with COVID-19 disease have low oxygen levels even when they're feeling well. Low oxygen levels can be early warning signs that medical intervention is needed. We can measure a patient's oxygen level by using a pulse oximeter device much like this one here. The device measures the amount of oxygen carried on the hemoglobin in the red blood cell. Knowing a patient's oxygen level is much like knowing their blood pressure and is an important part of their overall assessment. A normal oxygen level is greater than 92%. Some patients with chronic lung disease or sleep apnea may have slightly lower oxygen levels closer to 90%. Medical professionals should be consulted if a patient with a suspected or confirmed COVID-19 has an oxygen level less than 90%. To use a pulse oximeter device, follow the manufacturer's guidelines. Use a disinfectant wipe to clean the device before and after each use. The very first step is to turn on the power. Once you have the power turned on, place the device on your finger. You may see a beam of red light. The oxygen level is determined by measuring the amount of light that is absorbed as it passes through the fingertip. Wait for a number to display. In addition to the oxygen level, and depending on the exact device, it may also display your heart rate. Some factors that make it difficult for the device to read a patient's oxygen level include dark-colored nail polish, cold fingers or poor circulation, tremors or movement, low blood pressure, and perhaps too much pressure on the device itself. If you have an oxygen saturation level measuring less than 90%, call your doctor or 911. If you have any questions or trouble using your device, please call our nurse hotline at 210-575-0355. And thank you for choosing Methodist Healthcare.